Aloha Kauai, here's our COVID-19 briefing from Team Kauai for Friday, October 9th. Happy Aloha Friday. We currently have no active cases and all close contacts of last week's cases have completed quarantine. Our cumulative case count is at 59. Our police department continues to monitor roughly 2,000 people who are in travel-related quarantine. A majority of those are Kauai residents who have traveled off-island and returned. For additional information, please visit the Kauai Emergency Management Agency website at www.kauai.gov/COVID-19. The governor's new COVID-19 pre-arrival test plan goes into effect Thursday, October 15th. We are concerned that this single pre-arrival test will not provide enough protection for our community, which has enjoyed several months of low to no active cases. Our county proposed a second test system via Rule 18, which we felt would help to achieve our goal to reopen our economy in a phased, responsible approach. Unfortunately, our proposed Rule 18 was denied. In light of that denial, we have spent the last several days working with our health officials and partners to adjust our operational plan. That plan, Mayor's Emergency Rule 19, was submitted to Governor Ige on Thursday. While we maintain our position that a comprehensive pre- and post-arrival testing program is the safest option, and we will continue to work toward achieving that, we are confident that our proposed Rule 19 provides a clear path forward. Rule 19 would combine a voluntary testing program with a tiered system for responding to outbreaks. Currently, Kauai is in Tier 4, which is the least restrictive tier. At this tier, we will opt into the state's pre-travel testing program that begins on October 15th. Tier 4 means we are holding less than 2 cases on a 7-day average. Tier 3 assumes a 1-week average of 2 to 4 cases and includes tighter restrictions on gathering sizes for indoor and outdoor activities. Tier 2 is an important tier. For our proposal, should Kauai move to Tier 2, which assumes a 1-week average of 5 to 8 daily cases, it will trigger Kauai to automatically opt out of the state's pre-travel plan and continue a 14-day quarantine. If our cases continue to rise to more than 8 cases over a 7-day average, we would move to Tier 1, which activates the strongest restrictions while maintaining the mandatory 14-day quarantine. It is important to note that this is a proposal and requires the approval of the governor before it can be implemented. We'll keep the public updated on the status of our proposed Rule 19. Today, we have our District Health Officer, Dr. Janet Berryman, here to explain more about our tiered system.
Thank you, Mayor Kawakami. I wanted to provide a little background information on how we came up with this proposal. We sat down over several days and reviewed what we've learned about COVID-19 and the unique conditions on our island. We developed thresholds based on the information we have at our disposal now. That includes our experience over the last 6 months in Hawaii, how other communities have responded and their results, our small island's population, and our knowledge of our public health and healthcare resources here on Kauai. We do have limited public health and hospital capacity, and we must do everything we can to ensure that we do not exceed that capacity. Here's an example of some of the numbers we crunched to develop our response tiers. If we had 8 cases a day for a month, that would be 240 cases. With a statewide average of 1 patient in 10 needing hospitalization, that would result in 24 hospitalizations in a month. Our best information from our healthcare partners is that this would meet, but not exceed, our hospital, intensive care, and ventilator capacity. So we feel comfortable that this level keeps us within our local healthcare capacity. More than this would push us into dangerous territory. Less would be more manageable. I want to be clear that these are not precise calculations, but are educated decisions. This gives us a plan to which we can refer, which we can implement, and which we can adapt if that becomes necessary. It reflects the best thinking of all of us involved, but we also recognize that conditions are evolving. We will continue to assess and adjust our response as we move through the coming weeks and months, as we have since the early days of the pandemic. The tiered system establishes a rational basis for changing our response as disease rates increase. Our system has 4 tiers. Nearly all businesses are able to stay open as long as our new case count is just 1 or 2 cases per day, as it has been for several weeks, which we know is readily manageable on our island. If it gets higher, we would put gathering size limits and other restrictions in place in a proportional response. With a 7-day average of 5 to 8 new daily cases, we propose to withdraw from the governor's pre-test program and restore the 14-day mandatory quarantine for out-of-state travelers. If the Lieutenant Governor's proposed single-test program keeps numbers under control, our system keeps the economy open. If it begins to fail, we have a clear path forward. Meanwhile, the layered approach of prevention, detection, containment, and treatment remains important. The measures in this tiered system focus mostly on prevention, and prevention also depends on what each of us does every day. Wear our masks when we go out, avoid large gatherings, keep our distance, wash our hands, and stay home if we're sick. Mahalo.
Thank you, Dr. Berriman. As you said, our tiered system is intended to be flexible and will be adjusted as needed. We'll publish the details of our Rule 19 once we receive the Governor's approval. In addition to proposing a tiered system, Rule 19 allows us to be included in the state's surveillance testing program as announced by Lieutenant Governor Josh Green. We believe any additional testing program is a step in the right direction, and we look forward to receiving more details on the state's surveillance program. Additionally, the county is working with our private industry partners to launch our own campaign to encourage our incoming travelers, both visitors and returning residents, to voluntarily take a COVID-19 test 3 days after arrival into the state. For those visiting or returning to our island, we ask you to please help us to keep Kauai safe from COVID-19 by following 3 easy steps. Take 3, then test. That's our request. Step 1 is to take a pre-test 3 days or less before you arrive. Step 2 is to take a test voluntarily 3 days after you arrive. That's our request. Mahalo for your kukua to keep Kauai safe. Again, that's take 3, then test. That's our request. The county is working with our Visitors Bureau and private industry partners to create an incentive program and message campaign that will help us to promote our voluntary post-arrival program. Please stay tuned for more details in the coming days. While our tiered system creates a framework for us to follow, we all have the same goal to remain in our current Tier 4 so we can avoid reinstating more restrictive measures. That responsibility falls on every single one of us, whether you're a resident or visitor, traveling or staying home. The absolute most important thing we can do is to wear our mask when we're around people we don't live with, practice physical distancing, and avoid large gatherings. If we can commit to following these simple steps, we can help to prevent the spread of COVID-19 on our island. My mask protects you, and your mask protects me. Halloween is coming up, and the State Department of Health has issued some guidance on how to celebrate without putting our families at risk. While the Department of Health recommends against traditional door-to-door trick-or-treating, as it can be a high-risk activity, trick-or-treating will be allowed here on Kauai. Those who do plan to trick-or-treat should wear masks if age 5 or over and stay with your households in groups less than 10. Halloween should be focused on trick-or-treating for keiki and not for large gatherings. As a reminder, gatherings are limited to 25 outdoors and 10 indoors. There are many creative ways to have a safe, fun Halloween that doesn't involve traditional trick-or-treating. You can find national recommendations if you search for holiday celebrations at cdc.gov. You can also see more Halloween guidelines from the Department of Health at hawaiicovid19.com/news. Kauai's general election ballots are going in the mail starting today. If you're not yet registered to vote, you won't get a mailed ballot, but you can still register and vote in this election up to and including on election day. If you register after today, you will need to vote in person when County's Voter Service Center opens in the Pi'ikoi building from October 20th through Election Day, November 2nd. For additional information, please contact the Office of the County Clerk, Elections Division at 241-4800. There are still residents on our island who have not yet participated in the U.S. Census, the program to count every American once every 10 years. Getting everyone counted is very important to us. The funding of all kinds of federal programs, including school lunch help and food stamp assistance, rely on our population being fully counted. If our population is undercounted, money that should be going to us will go somewhere else. If you or anyone you know has not yet filed the census form, please visit my2020census.gov and do it today. Thank you, Kauai, for being responsible. Your diligence is helping us to keep this virus contained. We thank you for understanding the role you play in mitigating the spread of COVID-19 on our island. Please continue to stay home as much as possible. Refrain from social gatherings or public outings. If you must interact with people outside of your home, maintain a distance of 6 feet of separation and wear a mask, if at all possible for you to do so. Remember, my mask protects you and your mask protects me. It's a sign of respect and aloha. Do not leave home if you are sick unless you're seeking medical attention, and then only after calling your doctor first. Wash your hands frequently and clean surfaces often. Stay informed and connected during this time of social distancing. We'll continue to post updates on our official County of Kauai Facebook page or on our Kauai Emergency Management Agency page at www.kauai.gov/COVID-19. The Centers for Disease Control is also updating its website regularly. For more information, please visit coronavirus.gov. Not everyone has internet access or follows the news, so please help to keep your loved ones informed. Be kind, take care of one another, God bless, and aloha.